Hi, my name is Claire Waters, a Principal Public Health Practitioner. This is the first webinar in a series of 3 aimed at anyone working with children and young people, especially teachers. Today, I'm going to talk about the changing landscape of tobacco, nicotine and vaping products and the threat that they pose to young people across Wales. Let's start by addressing a common misconception, that smoking is no longer a major public health issue. In reality, smoking remains the single biggest cause of preventable death, disability and ill health. Across the UK, smoking is responsible for around 80,000 deaths each year, including 1 in 4 of all cancer deaths. That's a staggering toll for something that we can prevent. Zooming in on Wales, impact is still significant. Among people aged 35 and over, smoking causes nearly 4,000 deaths per year, which accounts for 10.7% of all deaths in that age group. It also leads to over 17,000 hospital admissions annually, placing a huge burden on our health services. And for individuals, the consequences are severe. The average smoker loses 10 years of life, which equates to around 1 year loss for every 4 years of smoking after the age of 30. Beyond the health implications, the economic cost is also eye-opening. In Wales, smoking costs the NHS £302 million per year, and when we include loss of productivity and other factors, the total cost rises to £791 million annually. So while smoking rates may have declined over the years, the problem is far from solved, and tackling it remains a critical priority for public health. Let me share a shocking fact with you. Cigarettes are the only legal consumer product that, when used exactly as the manufacturer intends, will kill in the majority of cases the people who use them. That's right. If you follow the instructions and smoke just as the tobacco companies designed, the odds are against you. 2 out of every 3 smokers will die as a result of their smoking unless they quit. This isn't about misuse or accidents. This is about a product doing exactly what it's made to do and leading to death in most cases. It's also responsible for a lot of ill health and many diseases such as cancers, respiratory disorders and cardiovascular disease. It's a stark reminder of just how dangerous smoking really is. Smoking remains one of the biggest drivers of health inequalities in our society. While smoking affects all groups, it does not affect all groups equally. In Wales, people living in the most deprived areas face a much higher burden from smoking than those in the least deprived areas. They are 3.4 times more likely to smoke, around 3 times more likely to be hospitalised with a smoking-related illness, and around 3 times more likely to die from one. These are not just statistics, they represent real lives, families and communities that are being hit hardest by smoking-related harm. Tackling smoking means tackling inequality. The Welsh Government has set a target of reducing smoking prevalence in adults to under 5% by 2030. This is part of the World Health Organisation's tobacco endgame target of creating smoke-free nations to eliminate tobacco use. Unfortunately, recent projections paint a more challenging picture. By 2030, smoking prevalence is expected to be 8.3%, and by 2035, it will still stand at 6.4%. This means the target of 5% is not expected to be met unless we change our approach or accelerate our efforts. While existing efforts like the All Wales Cessation Service Help Me Quit focus on supporting smokers to quit, increasing prevention activities is crucial to stop the start, by stopping young people from ever starting smoking and to achieve Wales' tobacco endgame targets. Smoke-Free Wales is our national long-term strategy with an ambition to create a Wales where smoking is no longer part of everyday life. This strategy is grounded in a clear vision, to make Wales smoke-free. To achieve this, we're focusing on 3 core aims. First, reducing inequalities. We know that smoking rates are much higher in our most disadvantaged communities. Tackling this is key to improving health outcomes and breaking the cycle of poverty-related illness. This strategy puts a strong focus on supporting those who need it most. Second, a focus on future generations. We're working to protect children and young people from the harms of tobacco, both directly and indirectly. This includes prevention campaigns, smoke-free environments, and ensuring young people grow up in a culture where smoking is no longer the norm. And third, a whole system approach. No single organisation can achieve this alone. This strategy brings together public health, education, local government, the NHS, and community organisations to tackle smoking from all angles. It's about creating supportive environments and joined up action across the system. By working together under these three key themes, we can build a healthier, fairer, smoke-free Wales for everyone, now and for future generations. To turn the Smoke-Free Wales strategy into action, we have a 2-year delivery plan which outlines priority areas for action. This includes smoke-free environments, where we're aiming to expand smoke-free spaces to shift social norms and protect young people from exposure to smoking. Prevention and cessation, to strengthen efforts to stop young people from starting to smoke, while optimising quitting support across settings like hospitals and communities. And focusing on priority groups, especially children and young people, and pregnant women to reduce smoking-related harms across generations. These priority areas give us a focused, ambitious, and achievable roadmap towards a truly smoke-free Wales. In terms of smoking prevalence, the overall proportion of learners in years 7 to 11 who report regular smoking has decreased from 3.1% in 2021 to 2.7% in 2023, suggesting a slight reduction in smoking rates among school-aged children. While our Year 11 students are most likely to report ever using tobacco, the decline in smoking rates is most pronounced among Year 11 students, where smoking dropped from 7.5% in 2021 to 5.5% in 2023, indicating a positive trend in reducing smoking among older students. Overall, while there's still work to do, these findings suggest that smoking rates among school-age learners are decreasing, which is encouraging. This data could reflect broader public health efforts to reduce smoking among young people. However, this decline could also be explained by a possible shift towards vape use in this age group, which we need to monitor closely. There is concern around vaping, particularly vaping among children and young people. Vaping is much less harmful than smoking and can help adults to quit smoking, but it's not without risks. Side effects are common, and we still don't fully understand the long-term health impacts. When it comes to children and young people, the message is clear: they should not use vapes. Despite this, we are seeing a worrying trend. Vaping among children and young people is increasing, including among those that have never smoked. This is especially concerning because these young people are being introduced to nicotine dependence at a very early age, and we know that nicotine dependence can affect brain development and well-being, particularly in adolescence. So in summary, while vaping can be a useful tool for adults to quit smoking, it poses a serious public health threat for children and young people, and one which we must tackle with urgency. This slide presents data on smoking and vaping trends among students in years 7 to 11 in Wales from 2017 to 2023. The bar chart illustrates the proportion of 3 different groups. Number 1, regular smokers, shown in pink. Number 2, regular dual users, both smoking and vaping, shown in blue-green. And regular only vapers, shown in dark blue. Looking at the trends over time, the proportions of regular-only smokers has decreased from 2.5% in 2017 to just 1% in 2023. The proportion of regular dual users has remained relatively stable, fluctuating slightly, but staying between 1.4% and 2%. The proportion of regular-only vapers has increased significantly, rising from 2% in 2017 to 5.2% in 2023. Overall, this data highlights a shift from smoking to vaping among young people, with vaping becoming more prevalent. It suggests that while traditional smoking is declining, vaping is on the rise, which has important public health implications. This graph shows the proportion of students in years 7 to 11 broken down by year group who reported ever using vapes, regularly using vapes, or regularly using tobacco in 2023. As you can see from the dark blue bars, vape use increases sharply by age. By year 11, 45.4% of learners said that they have tried vaping. That's nearly half of the year group. Even among year 8 pupils, 16% had tried it. Regular vaping, shown in light blue, also rises through the year groups, reaching 15.9% in year 11. That's a significant number of young people regularly using nicotine products. In comparison, regular tobacco smoking, shown in pink, is lower across all years, but still concerning. By year 11, 5.5% report regular smoking. This data highlights two key issues. First, vaping is now far more common than tobacco among young people. And second, the sharp rise in both ever and regular vape use from year 8 onwards shows this is becoming a major public health concern, particularly as many of these young people may have never smoked before. It reinforces the need for strong prevention measures, regulation, and support for young people to avoid nicotine addiction in all forms. So why is vaping a serious concern in our schools and community? Firstly, most vapes contain nicotine, which is highly addictive. Even when products are marketed as nicotine-free, testing has found that many still contain nicotine. This is worrying, as regular use can quickly lead to addiction. Nicotine affects brain development, especially in young people. It can interfere with concentration, memory, and the ability to learn, all of which can impact their academic performance and classroom behaviour. In the short term, we're also seeing physical side effects. Young people report headaches, sore throats, dizziness, and persistent coughs after using vapes. These symptoms can sometimes be mistaken for other issues, but they're often linked to vaping. When young people go without vaping, they may experience withdrawal symptoms, things like mood swings, poor sleep, and anxiety. These symptoms can impact their well-being, relationships, and engagement in school. There is growing evidence that vaping can be a gateway to smoking. Some students who would never consider picking up a cigarette may start vaping and then move on to tobacco, a concerning trend that reverses decades of progress. And finally, perhaps most importantly, we simply do not yet know the long-term health impacts of vaping. It took decades to fully understand the harms of smoking, and we mustn't make the same mistake again with vapes. In response to the threat of youth vaping, Public Health Wales convened the Vaping Incident Response Group, or the IRG. The group was set up to examine the evidence, track developments, and make recommendations for action across Wales. The IRG brought together a wide range of expertise, including public health professionals, educators, paediatric and respiratory clinicians, trading standards officers, third sector organisations, and academic researchers. The group first met in July 2023 and delivered its final report in April 2024. This collaborative approach has been vital in shaping a joint-up response to the rising use of vapes among children and young people. The IRG set out a clear goal to denormalise vaping among children and young people. To achieve this, the group made several key recommendations. To restrict marketing. This includes tighter controls on packaging, advertising, and how products are presented at point of sale. To limit flavours and product names to basic descriptors, such as tobacco, mint, menthol, and fruit, removing appealing or gimmicky names like bubblegum or unicorn that target young people. To ban disposable vapes, due to their environmental impact, ease of access, and their popularity with underage users. To introduce a tax on vaping products, although this would be set lower than tobacco to still support smokers looking to quit. And finally, establish a retail register for anyone selling tobacco or vapes to strengthen enforcement and accountability. These recommendations are designed to shift the culture around vaping and reduce its visibility and appeal to young people. In addition to denormalisation of vaping, children and young people who are addicted to vape should be offered support in the form of nicotine gum or patches to help them quit. There are already important laws in place around tobacco and vaping. It's illegal to sell tobacco or vapes containing nicotine to under 18s. This has been in place for vapes since 2015. For vape products specifically, there are regulations on nicotine strength and tank volume, and certain ingredients like colorants and caffeine are banned. Products must have clear labelling and health warnings, but we also know that illegal sales are common. Many of these products don't meet UK quality or safety standards, raising real concerns about harm. And finally, it's important to remember that we now have smoke-free laws covering not only indoor premises and vehicles, but also some outdoor spaces, such as schools, nurseries, playgrounds, and hospitals. These protections are in place, but enforcement and awareness are key to making them effective, especially in protecting children and young people. Wales introduced a ban on disposable vapes on the 1st of June 2025. This decision is backed by expert consensus that disposable vapes are a key driver in the rise of vaping among children and young people. There is also serious environmental impacts. Disposable vapes contribute to litter, and the chemicals inside can leak into the soil and waterways, harming wildlife. And beyond the environmental impact, batteries in these products have been linked to bin fires, creating yet another safety risk. This ban reflects growing recognition that disposable vapes are a threat to both public health and the environment. The UK government's Tobacco and Vapes Bill makes a historical shift in tobacco control. At its heart is the ambition to create the first smoke-free generation. Subject to approval from Parliament, the policy will come into force on the 1st of January 2027, when those born on the 1st of January 2009 turn 18. This means that this age group and anyone younger can never legally be sold tobacco products. The bill also proposes a new retail licensing scheme, aiming to better regulate who can sell tobacco and vaping products. To strengthen enforcement, it will introduce on-the-spot fines for underage sales and other breaches. There are plans for tighter restrictions on advertising and sponsorship, helping to further denormalise tobacco and vaping, especially for young people. This legislation could be a game changer in protecting children and young people from harm. Importantly, the bill also introduced new restrictions on vaping, including non-nicotine vapes. These include limits on vape flavours, packaging and how products are displayed in shops, a ban on vape vending machines and oral tobacco products, and new powers for Welsh Government to extend smoke-free laws to cover vaping and heated tobacco products. Altogether, this legislation represents a significant step forward in protecting young people and reducing harm across future generations. Public Health Wales has produced a number of resources, including guidance documents and toolkits to support work in this area. These include a curriculum toolkit on substance and addiction. This will be discussed in detail in webinar 2 of this series. The toolkit explores health harm and behaviour, specifically focusing on vaping within the context of substance misuse, addiction and dependency. It has been co-constructed with teachers for use with both primary school and secondary school learners from age 9 upwards. It includes key messages for teachers and learners and vaping knowledge banks for teachers. Information and guidance on vaping in secondary school age learners in Wales. This guidance includes data and evidence-based information for schools, including how they can respond to and help address vaping within their setting through policy, practices, and curriculum content. Young people and vaping, information for parents and carers. This is set to help guide and provide clear, evidence-based understanding of vaping amongst children and young people in Wales. The guidance includes up-to-date information on the health impacts of vaping and how many children and young people are currently vaping in Wales, as well as practical advice on how to spot the potential signs of vaping and how to approach a conversation about it. Your Quit Plan. This is an interactive digital tool available on the Help Me Quit website, which will support individuals to develop a personalised quit plan to reduce their dependency on nicotine products. Help Me Quit. This is our all-Wales smoking cessation service that offers tailored support to young people who smoke. Public Health Wales are in the process of developing a national pathway for supporting children and young people with nicotine dependence. Just Be. This is an evidence-based smoking prevention intervention developed and delivered in schools by Public Health Wales to influential Year 8 pupils in schools in areas where children are at the highest risk of smoking. It equips these young people with the knowledge, skills, and motivation to comfortably discuss the risks of smoking and the benefits of being smoke-free among their peers prior to the age of typical smoking initiation. Our 18 to 24-year-old prevention programme, where we are planning to work with further education colleges and employers to develop approaches and tools to promote smoke-free in these settings and prevent uptake of smoking in this age group. And finally, Ash Wales. They run the No If No Buts campaign, which enables anyone to report illegal sales and illegal products anonymously. I hope you have found this webinar useful, and thank you very much for listening.